Welcome back. Now, only 400 COVID-19 vaccination sites have been set up across South Africa, and 1% of the country's fully vaccinated. Now, this as the third wave sweeps across many provinces. Health NGO, Right to Care, and various other organizations have joined forces to offer a free course for healthcare professionals. Now, this is where they will learn there to set up vaccination centers. But of course, for more, I'm joined now by Right to Care Chief of Party for Vaccinations, Dr. Ntombi Sigwebela, who joins us via online. Thank you for your time, Doc, and good morning to you. You're offering more of education so that healthcare workers are more prepared to obviously administer these vaccines and have, fully fledged vaccination sites. What do these modules include particularly?
Good morning to you and your viewers, and thank you very much for inviting me to your show. So Right to Care is a 20-year-old NGO in South Africa, has been assisting the Department of Health in various areas around TB and HIV. And with the COVID-19 pandemic, we are helping again to make sure that South Africans are vaccinated to reduce the spread and achieve herd immunity. So we're offering this online course for people who work in health facilities, including planners, not just the doctors and the nurses and the other medical individuals. So this course is meant to assist with the ramping up of the rollout. The Department of Health is already offering the one crucial element of a vaccination program, which is the training of vaccinators. That is being done through the National Department of Health Knowledge Hub. We, as Right to Care, being funded by USAID and partnering with the Foundation for Development, for Professional Development, are offering a course that will assist with this, provide knowledge and understanding of how to rapidly set up a vaccination center. It's an 8-hour online course. It has got 4 modules, and it covers from how to identify a population that's to be vaccinated, how to set up the flow of in and out of a facility of patients, ensuring that you are providing all the necessary prevention measures for preventing COVID infection spread. This course is very practical in nature, which makes it quite unique, and it also anyone who attends the course will receive accreditation through CPD points.
And Doc, if I may just jump in there, I mean, obviously, the country's vaccination target of reaching herd immunity and targeting 60 to 70% population being vaccinated, quite important there, because I also heard the President making mention that he still reiterates his target of 300 vaccinations being administered daily, at least in a weekday. Clearly, we aren't ramping up this, rollout program fast enough. Where do you think the challenges are?
I think we haven't met expectations, but I think there has been a lot of work done already with 4 million people having been vaccinated. Yes, we are behind, but we need more sites. We need people to be able to access the vaccination sites. And the only way we do that is to work with the Department of Health to ensure that many more than the 400 mentioned, although it's around 900 today, many more facilities are being opened up so that people can go there. But we can't open up facilities if people do not know how to set them up and they do not know how to provide the vaccine. So that's where Right to Care then comes in, to provide this essential training and make it very short, 8 hours, and then facilities will have an idea and the knowledge, not just an idea, the knowledge and understand the pitfalls.
And I know, with that being said, you are prioritizing rural areas, remote communities. These are some of the most underserviced, communities, in as far as healthcare facilities are concerned, in terms of the high number of people dying and them just not being able to reach, hospitals or vaccination centers because it's so far from where they live. And I know the President also making mention that they will be reaching people where they are to make it easier. So this is also part of your priority, top on your agenda.
That's right. We have already started with community outreach mobile clinics, where we provide both the registration and the vaccination itself to rural communities. We go around in mobile vans into areas which we call mass vaccination sites. An example of it is what happened in the Eastern Cape last week with the vaccination of over 60s at the grant payment sites, at the SASSA grant payments, in collaboration with some other private sector partners. And in that opportunity alone, more than 3,000 over 60 people were vaccinated who otherwise would not have been able to access the vaccination sites. So we're doing a lot of innovation around bringing the vaccines closer to the people.
Yeah, I think that's some of the news, and the good news at least South Africans want to hear, that that vaccination drive being ramped up. And thanks to organizations as yourself, Right to Care, as well as other stakeholders for ensuring this is done. Chief of Party for Vaccinations, Dr. Ntombi Sigwebela, thank you for your time.